A hearty good evening to everyone, and welcome to a session on the topic of jaundice in newborns. We are pleased to have Dr. Abhishek Roy among us to educate us on this topic. Jaundice in newborns can be life threatening, and we are happy to be able to have Doctor to shed some light on this crucial topic. Doctor, you have the stage.
Hi everyone, my name is Dr. Abhishek and I am a consultant in pediatrics in Apollo Cradle Children Hospital in Indirapuram. So today I am going to discuss a very common condition in newborn, that is neonatal jaundice. So the neonatal jaundice is very common. Jaundice happens with all the newborns. Okay, so we have to see whether this jaundice needs to be treated or not, right? So the jaundice is very common from the physiological jaundice which usually appears in the newborn. They are usually arise on day 2, day 3, and they usually go away by days 6, day 7. So all jaundice need not to be treated. So we have to see whether this jaundice crosses a specific threshold value. So what factors it depends upon? It mainly depends upon the gestation of the baby, and it also depends upon any additional risk factors, right? So we have to see that any baby who's preterm or who is gestation less than 35 weeks old and having additional risk factors, in these babies, the threshold values or the cutoff value is on the lower side. So it depends upon the gestation mainly and depends upon the day of life of the baby, right? So we have to see these things, and we have to check the value of the jaundice levels. We usually follow the AAP, American Academy of Pediatric guidelines for the jaundice threshold values, and depending upon those values, we usually treat if it is needed, right? So a newborn baby at day two of life, usually the values, if it is a term baby, the values anything less than 8 or 9 is okay. So this jaundice need not to be treated. So these are physiological jaundices. So you have to, for reducing the jaundice at home, uh, a good feeding helps in reducing the jaundice, right? So if you feed the baby well, so the jaundice, the liver is not mature enough to excrete. So good feeding helps in reducing the jaundice by excreting in the urine and stool. Okay. There is no role of one great myth in the jaundice is regarding the role of sunlight. There is no role, there is no scientific evidence of reducing the jaundice from the sunlight. And also, there is no role of any specific food to omit any specific food in the mother's diet. So these are common myths. A good feeding. If you say, doctor, I'm getting discharged on day 3, what steps I do need to take to reduce the jaundice? So one and only thing is a good feeding. If you ensure good feeding, baby's hydration is good. So the baby, the jaundice in the water soluble form, it gets excreted out, right? Nowadays, we have a TCB machine by which we can non-invasively measure the transcutaneous bilirubin. That is a surrogate marker of the blood levels, right? So they give a fair idea how the jaundice is, progressing. The risk factors, which the common risk factors which we need to monitor in the babies for any rise in bilirubin, they're usually the blood group mismatch. Sometimes there can be RH incompatibility, like the mother is RH negative and the baby is having the RH positive blood group, or some kind of ABO incompatibility, like the mother is having O blood group and the baby is having any blood group apart from O, like A or B, something like this. Or any kind of baby having any kind of hematoma or any kind of bruises over the body, they all can exaggerate jaundice. Sometimes, like in normal delivery, use of such vacuum or something can cause the cephal hematoma, the collection of blood. So they all can exacerbate the jaundice. So we need to see these risk factors as well, and accordingly we follow up with the babies, right? So now, why we are worried about the jaundice? So worried is because very high jaundice, can cross the blood-brain barrier, and it can, cause damage to the brain centers. It can cause irreversible damages, right? So we need to monitor very closely regarding the progression of jaundice, right? So any kind of very suppose the jaundice is very high for that specific day and for the gestation of the baby, this can cause baby can present in the form of excessive very irritable, not accepting feed. Baby can get high pitched cry, and the tone can be of the baby can be raised. So these are all signs of bilirubin encephalopathy. So this means the jaundice is very high and affecting the brain. So urgent intervention needs to be done, right? So the commonest and the simplest way to treat jaundice, if the levels are above the physiological range, above the cutoff values, is using the phototherapy. So it is very simple and easy way to treat jaundice in newborn. So it is the blue wavelength, that is 460 to 490 nanometers, which is it it converts the bilirubin into the water soluble form, and it gets excreted. So this way it's a very effective way. In our setup, the jaundice usually in 24 hours, the jaundice comes down to below the cutoff values. So nowadays the phototherapy machines are very very effective, and they are LED machines. So is the only way to treat neonatal jaundice if they are above the specific the values. And in the babies, sometimes we need to do exchange transfusion as well. In the babies in which the level are very high, and they are in the exchange level ranges. So in that case, we need to do the exchange transfusion in those babies, right? So how can you see, how can you parents can see for the jaundice? So it's a yellowish discoloration. So usually, this jaundice is progressive from the from head to downwards position. So usually in mild jaundice, you find the yellowish discoloration on the face and the upper chest. But if the jaundice is progressing or in the higher side, so that jaundice will be more on the abdomen and the lower legs, and the color will be quite deep as well. So this way, you parents can understand the jaundice, and they should immediately seek the medical attention. So any queries any queries anyone having? No queries till now. So what else we need to know about jaundice is regarding when to follow up with the babies. Usually, if there are no risk factors, usually by day 4 or day 5, we need to follow up with the jaundice. And the jaundice, as you know, the physiological jaundice, the peak time for the physiological jaundice is day 6, day 7. So usually, if the jaundice levels are not very high on day 6, day 7, so there are very less chances, or very unlikely chances, that the level will rise further. Okay, so that is a safe thing. If the risk factors are there, any jaundice which is arising in 24 hours, is always a mostly a pathological jaundice. Workup needs to be done, and accordingly, the follow-ups needs to be more, needs to be earlier, and we follow up accordingly. Sometimes we need to, get some special test as well in case of the pathological jaundice, because there are few parameters in which the jaundice can can be very high. Some kind metabolic issues, some of the blood disorders, some hypothyroidism, G6PD deficiency. These all are some of the associated factors in which uh, the jaundice can get very can get very high. So we also need to do these tests if there is very high jaundice, or if there is recurrent jaundice. So these things need to be ruled out. So thank you very much. If you have any queries, you can just text or leave a message. I will just reply to all.